Stroke comes to most people's minds because after they've had a heart attack or even before a heart attack, we know people with diabetes have a higher incidence of stroke. Now, as I said earlier, remember, blood vessels go from head to toe. You don't know what part of your blood vessels is going to plug up first. If you plug up one in the carotid or up in your brain and you've had high blood pressure and it's put stress on that wall, you could have a stroke. Most strokes are ischemic in origin. That means they are lacking blood supply to that part of the head because something plugged up the blood vessel going to it. Most likely, again in diabetes patients, fat in your blood from improper diet and control of your cholesterol, not proper glucose control, not proper blood pressure control, all add to this risk. So you're double or triple your risk for stroke. If you've had a heart attack in the first year, most of the people that come back, there are 2 or 3 times more strokes because it's close to the heart. If you've damaged your heart, you can certainly imagine that you're only this far away from your carotid. You got 2 carotids in the front, you got a couple of vertebrals in the back. And that feeds your brain with 4 vessels. And fortunately, God gave you 4 vessels because many of you will need 4 because many people will come in, one's already closed. So you need to take care of it. But that's where the stroke comes from. You'll rupture a plaque and it'll go up. If you can imagine for a minute, if I went inside your leg and I took a camera and I look going through your artery, up to your aorta, up to your heart, up to your carotid artery, what would I see in a guy that's 50 years old with diabetes? Well, I would see things hanging off your aorta, big fatty things. Some of them be mobile, some of them are moving. And what that is basically things that could break off and embolize. Well, if you're up around the aortic arch where it comes right around by the heart, those can embolize and go up to your head and give you a stroke too. So most of you probably don't want to think about it, but if you look at your inside of your blood vessels and you open it up and look, it looks like a pizza. And that's a person 20 years old. A person 50, he looks like a pretty lot of different things on his pizza because that is aging process along with the advancement of atherosclerosis inside the arteries.